ICU, of whom 48 are ventilated. And it's pleasing to see those numbers continue to decline. Of the 8,950 positive test results, we've got 5,289 positive rapid antigen tests and 3,661 positive PCR tests. The 3,661 positive PCR results were returned from 44,172 PCR tests. Sadly, we are reporting the deaths of 19 people with COVID, 14 men and 5 women. And of the 19 people who died, 2 people were in their 50s, 1 person was in their 60s, 7 people were in their 70s, 5 were in their 80s, and 4 people were in their 90s. Can I just express my sincere condolences to those for the loss of their loved ones. Today we also take the opportunity to give some more in-depth understanding of those who have died and the characteristics in terms of vaccination and underlying health conditions. So in the period to the 4 p.m. on Thursday the 10th of February, we have recorded 141 deaths, 52 women and 89 men. 5 were in the age group 40 to 49, 3 were in the age group 50 to 59, 16 were in the age group 60 to 69, 34 were in the age group 70 to 79, 47 were in the age group 80 to 89, 35 were in the age group 90 to 99, and there was 1 person over 100 years of age. So of the 141 deaths, 32 were not vaccinated. 2 had had 1 dose, 75 had 2 doses, and 32 had 3 doses. 53 of the deaths occurred in residents of aged care facilities, and 11 were not vaccinated. 1 had received 1 dose, 23 had received 2 doses, and 18 had received 3 doses. There were 10 deaths in those under 65 years of age, 5 in their 40s, 3 in their 50s, and 2 in their early 60s. And we've been classifying and categorising the information from medical records to just better inform the public and the community about the risk factors associated with those deaths. And just to clarify that people might have multiple of these comorbidities, what we call those underlying health conditions. So 2 people had diabetes, 1 had cardiac disease, 4 had chronic pulmonary disease, chronic lung disease, not asthma, 3 had asthma, 2 had significant immunocompromise, 2 had significant renal disease, 2 had cancers, 2 had obstructive sleep apnea, and 1 had a chronic neurological condition. 4 were unvaccinated, 4 had 2 doses of vaccine, and 2 had 3 doses of vaccine, and 2 with the 3 doses had significant pre-existing comorbidities. In terms of the place of death, 9 people died in hospital and 1 died and was diagnosed at home in a post-mortem diagnosis. So that gentleman was a gentleman in his 40s, and it was diagnosed following the referral to coronial system. Can I just sort of re-emphasise that COVID is a serious disease across all age groups, so continue to get tested and get linked to care. Be aware of the signs your conditioning is worsening, and we've got some really practical information on a fact sheet called Testing Positive for COVID fact sheet. So please Google that if you've got COVID. You should be sent the links when you get that notification. But I would urge everyone to get tested. There are treatments available, and it's really important that people are linked to care. Notwithstanding, as a public health person, I also enjoy seeing the data in the age distribution, but it's really important people are linked to care to both get access to the antivirals and other therapies, and so they know where to escalate their concerns if their condition deteriorates. Thank you.